I had my thyroid removed in 1993 and it's been a continual weight gain since then. And about 6 years ago I went to another facility and sat in on one of their seminars and kept looking around saying, just not there yet. I heard that Signature Healthcare was offering it, and with being an employee here, I said, you know what, well maybe this is a good time for me to look into it again. When I went into the original seminar, I asked the question, I'm thinking lap band versus gastric bypass. And one of the doctors that was there actually looked at me and said, do you want a 35% chance of weight loss or a 75% chance of weight loss? I'm like, well, that's a stupid question. I want a 75% chance of weight loss. And he then told me then my way to go would be gastric bypass. Well, you have to see the nutritionist to actually have gastric bypass. You have to see them a certain amount of times, the psychologist and the surgeon. And I was having a hard time the first probably 3 or 4 weeks losing weight, and just by slight little changes in my diet, which I would have never thought would have made a difference, they made a difference that I was able to lose 22 pounds before surgery. So just very little small things, and also incorporating a protein shake every morning for breakfast, which I still do. It's my best friend, just because it fills you up for a great amount of hours so that you're not hungry. And post-operatively, the best thing that I get out of the whole surgery is that I'm not usually hungry. I just know when I'm supposed to eat. The recovery period post-operatively was not as bad as I thought it would be. Yes, it was painful for the first probably 4 or 5 days, but I was off all pain meds I had the surgery on Monday. By Saturday, I was off all pain meds and just taking Tylenol. The hardest part for me was sleeping, and I'm a side sleeper. So getting used to sleeping on my back was a very difficult thing. But other than that, it was not a hard recovery. Like, my parents actually had come up from Florida for my surgery, thinking that they'd be up for a month, and they left at the 2-week mark because I was doing so well. And I came back to work at the 4-week mark. I have made so many good acquaintances in the support groups. It's ironic that we're going there to support ourselves, but so many times we have people that are pre-operative coming in and sitting on our support groups listening to what we have to say. And I know for at least 2 people that we've made a huge difference as far as their choice to do it or not do it, because they're hearing our success stories, and they're hearing some people have had problems with it, some people have not, but they're hearing good and bad and making their decision based on that. So to me, that's supportive to me, that I know that I made the right decision, that I can help someone else. So if I can give anybody any advice, it's a great thing to do, it's the best thing I've ever done, and don't let anybody stop you.